I learned about organizational culture not in my previous healthcare experience. I learned about it at Johnson Space Center, where when you drive through the main gates here and you pass the Saturn V rocket in the rocket park, the organizational culture is quite evident, and you're joining a team of individuals that sent humans to the moon and brought them back. And you know, what's remarkable about that organization is the culture is palpable and tangible, and you're very quickly introduced into the culture. And you know, when we go and fly in space, when we fly, we're successful because we've got a large team of people on the ground supporting us, just like in a hospital. If we succeed at a difficult case, by and large it's because of the fact that we have a whole team of people who make that possible, particularly in the OR and a critical care environment and things. So looking at some of the peak performing teams, what are some of the common attributes? And you can go and read about this in Katzenbach and Smith's article. But basically, clear direction, strong communication between team members, clearly articulated culture or rules of behavior. People know how to work in the team, high levels of trust that get built in the team, spending time giving people feedback about how they're doing, listening to individuals in the team, being able to respond with constructive comments, mentoring and coaching to develop skills in individuals. Do these sorts of things happen in clinical teams? Some clinical teams, yes, and other clinical teams, not so much. And I think it's something that we can learn from these different environments to be able to go forward and implement them. So in terms of creating peak performing teams as leaders, what we do as leaders is fundamentally critical in being able to create a dynamic peak performing team. The first element comes from effective communication. And if there was one thing that I would love to change in our hospital, it's how effectively we can communicate. Because no matter how well we think we're doing at communication, you can always do it better, and we have to find different ways to be able to improve it. But building trust, we'll talk about followership styles and leadership styles in a little bit, looking at defining goals, measuring progress towards goals, creating an environment where people are introspective in their practice, where they're seeking feedback independently. That's the one thing, if I were to pick one major thing that's a difference between the aviation world and my world as an emergency physician. As a pilot, I'm always asking for feedback. As a doctor, I'm never asking for feedback. I don't understand, you know. So now as a physician, of course I ask for feedback, but when I was in clinical practice, I would never ask for feedback, even from my colleagues, let alone from the nurses that I'm working with or whatever. So soliciting feedback, resolving conflicts, and looking at errors as an opportunity for learning instead of an opportunity for criticism. We do a lot of pre-briefing and debriefing in the aviation world, and in medicine we're starting to do that with a safe surgical checklist. And in some other cases, we're doing pre-briefing and debriefing as well. Most physicians that I talk to say, you know, you just don't understand. And I said, well, what do you mean? I said, well, we just don't have time in today's modern, demanding clinical environment to do pre-briefing and debriefing. And yet, in the aviation world, we have the same time pressures that we do in clinical practice, and yet we manage to do this. So it's a cultural phenomenon, and it's basically an opportunity to open the door to create this as part of the culture as well.